It was a rough road for Josh, and he started using opioids when he was in college.
Carol and Bob Symes watched their son Josh struggle with substance misuse for much of his adult life. First OxyContin or Percocet pills, then after college he turned to a cheaper heroin and eventually fentanyl.
It was obvious that we had big problems, and he went to Ashley for rehab for a 30-day, 28 days, I guess, and did really well there.
But he relapsed several times. Carol says the 9 months before he died were the happiest her son had been. But October 12th, when he didn't answer his phone, the parents asked the D.C. police to do a wellness check.
Got there and got in, and he was not breathing, and they did everything they could.
After a few days in the hospital, doctors determined Josh was brain dead. After donating his organs, the family let him go the day after his 31st birthday, a birthday he shared with identical twin Billy.
We were shocked when they said that there was only cocaine in his system, and we knew that that wasn't the case. So we, from Josh's own mouth, he had told us that anytime he did an opiate these days, it was probably fentanyl.
Carol is certain fentanyl killed him. It was found in his apartment, but the hospital's toxicology test did not test for fentanyl. So his girlfriend Melanie Yates did some research and found that not all hospitals test for the drug. The family is now working with lawmakers in Annapolis on legislation to change that.
So what we're saying is that if a healthcare provider in the hospital chooses to run a urine drug screen, that should also include fentanyl. We're not trying to mandate what a doctor should or should not do. We're just saying we can see how prevalent fentanyl is right now. That should be included in a urine drug screen.
A drug so powerful that with one interaction, it can take a life. Lisa Robinson, WBAL, TV 11 News.